Because we have an email from Colette in Madison, Wisconsin. She writes, our newborn baby didn't pass his first stool, and the doctors had to operate and take out part of his colon. They call it Hirschsprungs, and we wonder if he'll have any long-term effects from it. We have not talked, to my knowledge, about Hirschsprungs
this is a
before
first,
on
I
the show.
think. That's one of the big things we ask as pediatricians when they're born. You know, when did they pass their first stool? Because if it gets after a couple of days, we start worrying about Hirschsprungs.
Yeah, some people are born without the nerve endings to the colon. So without that, the colon can't move. So when babies are born, they have this mucus that they're born with, and within the first, 24 to 48 hours, they should
usually
have that bowel movement. So the little red dots, that's a normal colon. That is trying to move, we'll call it poop, because I don't know what the sensors let us say, but trying to move the poop, stool down. This part of the colon isn't working. So what happens is the stool goes down and it gets stuck at a certain point. And then the other part of the colon, since it's not being moved, just starts inflating and inflating. So if you have a brand new baby and they don't have a stool within the first 48 hours, that's a problem. If they're uncomfortable, right, bloating.
Or if just very infrequent stools, and when they do go, it's very explosive. That's, it builds up and then
because there are lesser degrees of this, and it doesn't affect the whole colon. So the treatment for this, which is life-saving, you actually take out the part of the intestine that doesn't work, and you reconnect it end to end, and then the train will just go right down the tracks
and
after
that's
that.
why we're lucky. We're lucky because if all goes well, we don't need all of our colon. So that's the good news. If you get it diagnosed, you can do something about it, and if all goes well, the child should be able to live a fairly normal life.
Yeah, a normal life.
Always a pleasure.
Hey,
Thank you so very much.